Hello, Miss. Good day. Today I'm going to examine the female breast and male breast. Um, I already prepared my equipment for me to get those equipment easily for me to use with my patient. And also, I may introduce myself to the patients and identify the patient condition or identity for me to fast or easily cooperation with the patients. Hello, Mister, I'm student nurse and I'm going to examine your breast today. So, how are you today? So, unsa imong ngalan?
Albert Alban.
So, nabaroy sakit ba ni imong diri mga tutoy?
Manila.
Okay. And also, I already washed my hands for me to spread the virus and before to start my examine for the breast, I'm going to wear the disposal gloves. Now I'm done wearing my disposal glove. And the first of the checklist was to greet the woman respectively. Hello, ma'am. Good morning. Okay. So today, and also told the woman that I'm going to check or examine the breast. Karon, ma'am, ako ang i-examine yung breast kung naabay mga abnormalities. Okay? And also, tell the woman that he will wear the patient gown. Imo ning suoton para dali na akong ma-examine or ma-touch imo ha breast. Okay? This is the examination gown or patient gown. It also try to ask the woman if there is any history for surgery in breast or therapy. So, nakuha na ba ka ma'am na surgery na ba ni imong tutoy or nato na ba nag-hospital para ipatanaw nga na ay sakit ng tutoy ng anak? Wala. Okay. So, karon ako i-examine imong tutoy if I want to see if there is any abnormalities. Okay. Okay. Now let's go for the performance phase to inspect the brace and the axilla. So the first thing to do is to inspect the general appearance to note any symmetry, shape, and size with the breast. This is to check if there is any abnormalities or unsymmetrical. Okay, when I inspect, there is no unsymmetrical, so it is normal. The next is to inspect the skin. This time, to inspect the color, the textile, the bumbling, and pimpling, or check if there is any lesion or edema. Okay, when I having the inspection with the color, it is normal. The next is to inspect the nipples. And now, the next is to check the nipple, to inspect the symmetry, the size, any ulceration or bleeding, or any discharges with the nipple. So when I inspecting, there is no any unsymmetrical, so this no bleeding or any ulceration, so this the nipple was normal. The next is the maneuver screen. So direct the woman that change position while check the breast for skin retraction sign. So the first thing to do is lift the arm or slowly over the head. Then next is to ask her to push her hips. Okay, push her. The next is ask her to push her two palms together. Okay. The next is ask her with ask her with large pendulous breast. With support, lean forward when I am supporting the forehead. So lean forward. Okay. So why I'm expecting for maneuver screen, there is no any retraction sign, so it is very normal. The next was to inspect and palpate the axilla. So direct the woman to have a sitting position. So they could now. So the first thing to do is to inspect the skin and noting any rashes and inspection. Okay, was normal. This is no rashes and inspection. The next is lift the woman arm by supporting it yourself. So palpate the axilla. So use the right finger to check the left axilla. Then reach your finger high into the axilla. Okay, when I'm checking, the axilla was normal. The next is to palpate the brace. So help the patient to supine position. Untrap the small pads or towel to be palpated and raise the patient arm over the head. So use your three pads. Use your pads of the three fingers to palpate the breast and make gentle to rotary motion of the breast. Now I am palpating the concentric cycle. For me to know if there is abnormality when I am palpating. Okay, that was very normal. Next is to palpate the nipple. So palpate around the areola. Then gently press it between the thumb index finger to see if there is any discharge appear, and note the color and consistency of the nipple. Okay. Okay, there is no discharge appear in. Okay, when I'm checking or palpating the areola or the nipple was normal. Now I'm then checking for the woman breast, or examine the woman breast. I am now having the report form. So the things that I examined to you for today now is what's very normal, and what I'm doing with you, that is a normal. Okay? Okay. Now I am having to check the male breast. So the first thing to do is to inspect the cheese wall, noting for skin surface and any lump or swelling. Okay, there is no, so what's normal. And next is to palpate the nipple area for any tissue enlargement. Okay, there is no tissue enlargement, so when I palpating wet, so was normal. So that's all about the male breast. So I am now to have the record form or findings. So when I'm checking, so, sir, when I'm checking your breast was very normal. So when I'm doing anything else, that was the normal, because I'm checking your breast. Okay. Okay. So thank you. Hello, ma'am. So today I'm going to have the abdominal examined. So I already prepared my equipment being needed for me to get easily those equipment that I'm going to use. Then I introduce myself and identify the patient condition or identity for me to have pass this cooperation with. So I'm Nurse Romel. Today I'm examining your abdominal. So, how are you today? What's your ngalan?
Albert P. Albano.
Okay, so wala pa tayong bating sakit diri nga part, yeah?
Wala.
Okay, then I already closed the window for the privacy of my patient, so minimize the embarrassment. And also, I already wash my hands to prevent any spreading virus. So, sir, wala ba kayo mga history nga nagpa-check as multiyan or na surgeries multiyan? Wala? Okay, so now we are starting for the first checklist. The first thing to, before anything else, wear the gloves. Disposable gloves. Now for the preparatory phase, my patient was in supine, so the next is to bend your knee, okay, then your arm should be on this side, then should the abdominal visible, okay, sorry, then the room was warm and quiet. Then the next is try to acquire or try to ask the patient, this area, was there any painful? Okay. Nabay sakit ni sakit mo the answer di. How about the rest? Sorry. Very that it's okay. Okay. And now for the performance phase to inspect the abdomen. The first is the contour. So, stand the side of the patient and look the abdomen of the patient. Okay. So, there's no changes here. Okay, was normal. And now to check the symmetry, if there is the unsymmetrical with my patient. Okay, can you take breaths, right? Take breath, deep breath. One more time. Okay. And the next is to check the skin if there is any lesion, bulging, or inflammation. Okay. So none was normal. And the next is to check the umbilicus. If there is to inspect the contour, the localization, and the inflammation or bulging. So none. So when I inspecting the abdomen, was everything is normal. Okay. Now I'm going to auscultation the vowel sound and the vascular sound. So first thing is the vowel sound. So you get the stethoscope. Use the diaphragm to check the vowel sound. So before I'm having the percussion or palpating, the first thing to do is to auscultating the vowel sound. This is to check the characters frequency of the vowel sound. Okay. Okay, the vowel sound was normal. The next is to auscultate the vascular sound. Use the bill of the stethoscope by checking the vascular sound. Okay, using the Permer pressure, they check the aorta, Raynaud disease, the iliac, the femoral artery. Okay. And note for any location, pitch, timing for checking a vascular sound. Okay, the sounds was normal. Okay, when I auscultating the vowel sound and the vascular sound was normal. Okay. The next is to percussion the general tympani, the liver pump, and the splenic dullness. So percuss the abdomen, all four quadrant of the abdomen. So note any dull, large dull area, no, that might indicate underlying mass or enlargement organ. Okay. First is the right upper quadrant. Okay. Left upper quadrant. Right lower quadrant. The left lower quadrant. Okay, when I percussing the all four quadrant, there is no enlargement organ or dull, large dull area. So that was when I am percussing. It is normal. The next was to palpate surface and deep area for the abdomen. So the first thing to do is the light palpation. So my patient was supine, so I press it in the 1 centimeter, the all quadrant in clockwise. Okay. Okay, for the light palpation, there is no any abnormalities that I find. So what's normal? Now let's go for the deep palpation. So press it to 2 to 3 inches. So for the deep palpating was also normal. So I'm done palpating, or I'm done examining or assessment or assessing the abdominal of my patient. So I'm now having the report form. Okay. All the things was normal. The finding of my patient is normal. Okay. So that's all about for examining the abdomen of my patient. So thank you so much, sir. Okay. Thank you.